part of the health care reform bill that calls for taxing expensive private health insurance plans. Those are just the kinds of plans the unions enjoy, and now they're fighting tooth and nail to get those tax provisions killed. Here's the question, though. Can the Democrats get any kind of health care bill passed without union support? Let's ask union opponent Mark Mix. He's the president of National Right to Work's Committee. Good morning, Mark, or good afternoon, Mark. Good to see you.
Good afternoon, Alexis. Thanks for having me on.
Okay, most people don't get this, so explain this. Why would unions in particular care about Cadillac Insurance health care plans?
Well, that's one of the reasons why unions would sell their services to workers, in that they can negotiate plans that are very effective and have great coverage and require employers to pay a large share of the premiums and just offer good products. But it's interesting, I find, that on the one hand their opposition is for tax increases for their plans, but yet, you know, we're not really sure why they're opposing this, and despite all the activity over the last couple of days, you know, it seems like they're just interested in having a bill that would have government-run insurance, and that's what this is all about.
So to get this straight here, I talked to Ron Gettelfinger, who runs the UAW, yesterday morning. There were about 30 unions who publicized all over newspapers all over the country why they're against Max Baucus's plan. Does it stem from, number one, the Cadillac plans that they have, and number two, the fact that they want a public option?
Yeah. Well, I think the primary message is they want government-run insurance. That's what they want. And the Cadillac, the tax on so-called Cadillac plans is something that they're opposed. But then again, the American people are opposed to tax increases for this purposes. So I'm not surprised that organized labor wants to avoid taxes. That's a common complaint with what we're seeing as this government-run insurance program and concerns of the American people. And I'll bet you, if Ron Gettelfinger would talk to the rank-and-file members of the United Auto Workers, they don't want to pay additional taxes, and they don't want government-run insurance either. But the unions are spending their hard-earned, forced-use dollars in many cases to promote a plan that would expand government's role in insurance.
So why is there a disparity between what the leaders of the unions want and what the workers want? What's the backstory here?
Well, that's the $64,000 question in labor relations, and it has been since the 1930s. Organized labor officials have monopoly bargaining privileges over workers that says basically you take what we give you and you shut up about it. And in this case, they're using forced use dollars to promote a government-run insurance program that I think rank-and-file workers oppose. They're concerned about their health care choices, obviously, but when organized labor runs ads saying, you know, it doesn't have the government-run option in it, I wonder what the rank-and-file workers would say. Unfortunately, workers in America are forced to accept the representation of these unions as a condition of keeping their jobs.
Here's the thing, Mark. I mean, the obvious question is, do these guys actually think that those Cadillac plans that they've been able to get deals on for decades are bygone? That era is over, and they're now going to be the ones stuck with the government insurance plan, and that's why they need to see it passed.
Well, I think there's something to that, and it goes right to the question that we're faced with right now is, you know, the Baucus plan. I think the original bill, H.R. 3200, had a $10 billion bailout for union programs that are basically insolvent. The Detroit Free Press is reporting that the Baucus, quote, concept, although it lacks statutory language in many cases, still has a $5 billion bailout for organized labor, so-called voluntary employment bargaining agreements, these VEBAs that came out of GM and Chrysler. So we're not sure what it is they really want. What we think we know what they want is they want government-run insurance.
So if Rahm Emanuel cannot get them to stop doing these advertisements, what does this mean for health care reform, and particularly for the Democrats that these unions help put in office?
Well, it may be that there's a little game afoot, and that is that by organized labor coming out and saying the bill needs reform, that might somehow convince the rank-and-file workers and the general public that somehow the bill that's being offered now by Baucus, although I guess we don't even know what that is at this point, is somehow acceptable. And, you know, sometimes legislation is decided about who your enemies and who your friends are. In this case, organized labor may be too smart by half in the sense that they're saying, yeah, we oppose it because it's not big enough, and somehow that means it's acceptable to the rest of the American people. I think the American people aren't buying that.
The lobbyists are very busy people, Mark. Thank you very much. Good seeing you.